What was the vision for the health science libraries and how it could best support students and faculty inside the new Health Sciences Education Center?
We developed our vision for this library around one key question. How can we bring together librarian expertise, digital content, flexible spaces, and new technologies to advance teaching and learning and really help prepare our students to become the next generation of healthcare providers? We developed this vision around three core principles. I think the first one was really collaboration. We know that we're not doing it alone, and this building is just a fabulous way to bring all the various constituents together, from simulation center to our faculty, to our instructional designers, our librarians, to really realize this vision. We also believe the second principle is that the library is inherently interprofessional. We're a common good, and we work across all of the disciplines, all of the schools, all of the colleges. And our third principle was, as a common good, we can provide shared technology along with our knowledge of how it can be integrated into the curriculum to deepen student learning, to help our faculty change the way they teach, and to facilitate innovation and knowledge creation. So we kind of see ourselves as the glue here that helps support this new way of teaching and learning.
The library spaces in HSEC really represent a shift from how people traditionally think about library spaces and services. What you're offering is a huge emphasis on how technology plays a role in health science education. Can you talk more about that?
Our alumni who graduated even 10 years ago would have used the library in a very different way from the way it's being used today. So for example, 94% of our print collection is now in a storage facility, and we've invested heavily in digital content that can be integrated into the online learning environment. We've also invested in a rich set of flexible spaces and high-tech tools to spark innovation, collaboration, and creative problem solving. We have a maker and innovation space, a virtual reality studio, and a data and visualization lab.
Let's dig into that a little bit more. Can you give us some examples of how those specific spaces would be used by our various health science students?
For our virtual reality studio, we've been working with the physical therapy faculty to immerse students and practicing physical therapists into virtual reality, or what we call VR, and to discuss its clinical applications. So VR has great potential to increase the efficacy of physical therapy. It's more engaging than regular repetitive physical therapy. They're better able to use it to track outcomes, and you can allow a high quality physical therapy experience to be done at home. Immersing public health students in a virtual natural disaster and learning and practicing how to respond. Boy, isn't that a critical topic these days. Another example is our maker and innovation space. And for example, 3D printers are currently being used in the healthcare environment. So we really want to introduce our students to that type of technology and to help them understand its potential. So a particularly important application there is taking a 2D image, say an MRI, and translating it into a 3D model in order to train our students. Certainly surgeons nowadays, they can look at those images, but what they really need is that 3D model to anticipate what that surgery might look like and prepare before they actually go in and work with the patient. And finally, virtual reality could be used to help students develop deeper empathy for the patient by providing those students with a virtual experience of, say, the perspective of a person with autism or a person with dementia.
What else would you like our audience to know about the health science libraries today?
First off, librarians bring deep expertise to health education, particularly around experiential learning and knowledge creation. And as much as we are focusing on emerging technologies, we should also remember that we have an incredible resource in the Wangenstein Historical Library of Biology and Medicine. It's a world-renowned collection of 80,000 rare books, manuscripts, and artifacts, and the collection spans all of the health sciences disciplines. It's there to help our students understand the origins of their profession. That library is a true treasure.